Alright, so for the next aspect which we'll get to discuss, this is the risk factors for respiratory distress syndrome. So risk factors for respiratory distress syndrome is more of like what will actually make it easier for you to have the disease. Okay, so risk factors for respiratory distress syndrome, of course, respiratory distress syndrome is a condition that occurs in what? Neonate, that's newborn babies, and also the adults. Okay, so for neonatal ones, the most predominant risk factor if a baby is born before their time. Okay, so of course, the more far away the baby is to their time, the more they risk. Okay, so sometimes to elective deliveries before the week 40. Okay, so a lot of things, the lungs have not developed, and the baby didn't actually go through the birth canal for all those stress, okay, to like widen up the lungs. Okay, so all of that actually contributes to the baby having issues with breathing after birth. If the mother has an underlying diabetes, so diabetes usually delays how the lungs of the baby will develop. It occurs more in male sex babies if there was cesarean section. So there's no labor, there's no trouble to widen up the lungs of the baby, you understand. Then perinatal asphyxia, genital factors. Okay, then sometimes it's just genetic factors. Okay, so for the adults, that's occurring in people that are elderly. So elderly people mostly is an underlying disease condition that is making it difficult for you to breathe. Okay, so it could be that you have had sepsis. Okay, that's a bloodstream infection, COVID-19, trauma, aspiration, pancreatitis, massive transfusions of bones, lifestyle factors, genetic predisposition. So some people too, they can just inherit some disease conditions that are just generally making it very difficult for them to be able to breathe. Okay, so that's what we have here for the risk factors for respiratory distress syndrome.